Friends, family, and cohorts, welcome back to another episode of the Fight or Flight podcast. Here we go beyond the headlines and beyond the surface to meet those who endure, evolve, and excel. Today is a very special episode. My guest is Dr. Jonathan Edwards, physician, athlete, author, and a pioneer in pain management and mental health innovation. He's raced motocross, competed as a Cat 1 cyclist, served as a team physician, has had elite athletes under his care, including Romain Bardet, Tour de France podium finisher, Ricky Braddock, first American Dakar Rally motocross winner. I hope I'm pronouncing all the names correctly. Yeah. Misha Tate. Thank you. Misha, amazing fighter. One of my favorite women's bantamweight champions, Zach Osborne, Brenda Martinez, an Olympic middle distance runner, world champion medalist, complete rock star. Gray Maynard, former UFC lightweight contender, among many, many others. And the common DNA, the commonality between this is Dr. Edwards is pushing the frontiers of percutaneous hydrotomy as well as ketamine therapy. Dr. Edward explores consciousness, alternative realities, peak human performance, and in my opinion, the intersection of mind, body, and also spirit. So what we're about to hear today includes unexpected insights from extreme experiences and moments where medicine, mortality, and human potential collide. Dr. Edwards, welcome.
Wow.
And it's a complete honor to have you here.
Quite an intro, and that's very kind. That's
our creative and post-production Anna says, shorten it, get to the point. And I had such a difficult time because I have 4 books that you've published. I've got medical innovations that you've done. I'm like, how do I pack all this in? Not to mention a Supreme Court involvement. So it's a real pleasure. Dr. Edwards, one of the themes we have here on this podcast is pain, emotional pain, physical pain, financial pain, and how our participants address it. And not for the drama, but for the resurrection and the redemption that comes with those lessons. You shared with me a very personal point. You lost both your father and your grandfather to suicide, a pain that would have consumed most people. And I'm very curious how you transform that grief into the life and work that you lead today and how it shaped your relationships with patients, medicine, and yourself.
Yeah, thanks. And you can call me Jonathan. It's fine.
Thank you.
Yeah, pain is something I've been near and dear all my life. You know, for some reason I've always been able to withstand pain. I was one of those kids, you know, you could cut, I'd fell and, you know, didn't feel it kind of thing. And it wasn't a medical problem. It's just, I just had a higher pain threshold for those things, riding a bicycle or, you know, running, or when I raced motocross, you know, in that sense, you know, that's a different type of pain. But I guess the point I'm making, pain's as real as it get, you know, it crosses all barriers. It doesn't matter, you know, where you came from, what you were born into, if you're wealthy or poor, pain's as real as it gets. There's just, you know, no other way to really say that. So, yeah. And then, when I was 7 years old, I remember my parents taking me over, say, we're going to grandma and grandpa's house. And they said something happened to grandpa. And then I remember walking in that door and then seeing, you know, everybody wailing and crying like I'd never seen before. And I'd looked at the couch. There was a big red blood stain there. And then I saw, you know, the body of my grandfather in the other room covered in a white sheet, still trying to take it all in, you know, at 7 years old. And then I quickly realized, you know, he'd taken his own life with a shotgun. And so that was my first exposure to suicide or death, so to speak. And I remember just before that, my grandfather was put on oxygen from his smoking and COPD. You know, and he was born on an Indian reservation, so he kind of had that mentality. You know, it's like I believe that he just figured this isn't a way to live life, and my time's up and I'm going, you know. And that
Hmm.
wasn't uncommon of Native Americans if you look back in history. That experience shaped me profoundly, obviously, right up into school and medical school. And then I remember being in medical school, I remember seeing the psychiatric wards. We had to do 4 months in just psychiatric wards. So I saw everything you can imagine, suicidality to, bipolar, schizophrenia, you name it, depression. And I remember thinking to myself, man, there's nothing we can do for suicide. Like, there's nothing. I mean, there was, electroconvulsive therapy, but that's pretty barbaric, and it worked in some people, and I actually witnessed it, and I've actually done the anesthesia for that. And then in the early 2000s, I remember seeing ketamine being repurposed. Ketamine is a anesthetic, of course, that, I used for many years before that. And this, I remember seeing it, and I was like, wow, they're starting to study ketamine for suicide. And then I kind of just left it there. And then that story continues the day I met Gavin DeBecker. So Gavin DeBecker, as you know, he wrote the Gift of Fear. He's been on Oprah several times. He's a criminologist and actually wrote a recent book called Forbidden Facts that's just coming out. And he asked me one day, he goes, Jonathan, so what do you think about the drug ketamine? And we were talking, and I was like, that's kind of a softball question. I'm a board certified anesthesiologist, and I'm like, what are
Right.
you getting at? And then so I told him, yeah, it's a drug I've used. It's safe. It's used in pediatrics. It's on the WHO essential list of medication. It's used as a buddy drug in the Vietnam War. It's still used today in battlefields because it's extremely safe. It doesn't require a source of extraneous oxygen because it doesn't suppress respirations, making it safer than, say, propofol or pentothal. It doesn't mess with the blood pressure too much. But then I said, I also know it's been repurposed to treat depression, PTSD, and even suicide. And he stopped me right there and he goes, Jonathan, and you have to know, Gavin, I'm glad you answered the question that way. But I want to tell you right here and now, if you had answered it the other way, I was prepared. so, so
Okay.
anyway, right then and there, he said, Jonathan, this book needs to be written. It's not written. It's a little known drug, and people need to know about it. He goes, I'm proposing to you right now, if you write this book, I'll write your forward.
So, what is the deepest misunderstanding with ketamine, and why is there such reluctance to push it clinically farther than what they're doing today?
Uh, it's a good question. Yeah. It's stigmas are hard to break.
And what is the stigma
It's a
associated with
party
ketamine?
drug. It's a horse tranquilizer. It's you know most people don't realize it's still used in the hospitals. They think it's just an anesthetic, and yet more so a veterinary anesthetic. And at first it was made in human anesthesia in the 60s, and then FDA fast tracked it for the Vietnam War in the 70s. But it was a revolution. I mean, it was the most popular anesthetic because you could give it to kids and not suppress their breathing. You could set bones with it in the emergency room. You could perform surgery in a tent, which, think of the value of that, when you got, military actions involved, in Afghanistan, Iraq, in the desert or jungles, or it's still the most worldwide used anesthetic even today. Why? Because it's safe. It's on the WHO essential list of medications, and but yet it still has the stigmata, special K, this kind of thing, just being a party drug, and it's taken a lot of work to change that stigmata, and of course, the debacles, with Matthew Perry dying in part from ketamine didn't help. Doesn't help that it's the most abused drug in Asia. Doesn't help that you've had other anecdotal deaths from it, just like other drugs, though. But it pales in comparison to, say, fentanyl or heroin or cocaine as far as the
Yeah.
deaths. caused by those drugs. But when you see something that can stop suicide in its tracks, it's something. And I've actually seen it. I've administered to suicidal patients, and I've seen it myself stop suicide in its tracks. And we have no other drug right now, at least, that's legal and available and prescribable than ketamine for that. Nothing else. Not psilocybin, not MDMA, not LSD, nothing. Nothing is prescribable. It doesn't.
How does it work? What does it do to a patient that's in this crisis that allows it to move them
So,
physiologically and psychologically?
yeah. So that's obviously a good question. So, it's a psychedelic like drug. Technically in science terms, it's not a psychedelic, but it's for all intents and purposes, it's a psychedelic. So what does that do? What does that mean? So the definition of a psychedelic is something that puts you in a loss of ego, meaning the arrogance, in a sense, to stay in this reality is lost. So you let yourself go into another consciousness. You lose sense of time. You lose sense of maybe even where you are. You lose, it's an oceanic sense of that, you just see that, that calmness if you were in the water and you just like, oh, everything's calm here. It produces that. Most psychedelics do. So that's the initial effects of when properly used as a, psychedelic. Of course, if you give the big enough dose, it's an anesthetic. So the dose for giving it as a mental health drug is much, much less. The other reason it works is because it actually has direct effects on the brain, like neuroplasticity. What does that mean? So most people in PTSD, which you can imagine, they're in a continuous rut. They can't get out of it. Every day of their life is spent trying to get out of that rut, but the PTSD brings them right back to it. And something I learned from Jordan Peterson is that PTSD isn't just something you get rid of. PTSD is something that has you.
Hmm. Wow.
Yeah, you can't,
Yeah.
people just say like, I remember, yeah, one of these writers, Alex Berenson, he's got his popular Substack, said, oh, just PTSD is just a soft term, and I think even Trump said the same thing. Yeah, it's just something they just need to get over. That's not the case.
Yeah.
That's not the case at all. It's so far from the truth. And sure, there's some people who overplay their PTSD to get over whatever benefits that derive from it. But you know, when you have 20 to 40 veteran service members taking their own lives through suicide each and every day, I mean that's a fully loaded Airbus every day hitting the ground like a lawn dart, right? And
Hmm.
that's really happening. And a lot of that is just PTSD, not to mention the depression that goes with it, and and that brings us to the ingredients of suicide, which are
Yes.
easy to say in this day and age. It's isolation, it's being a burden on society or your family, a state of hopelessness, and a severe vulnerable moment with a means to a lethal weapon. And you think of our veterans, that's easy for them. They're trained killers. Every one of them know how to use a gun and use it well.
Sure.
So going back to like how it works. So imagine ketamine. It's like kind of like fertilizer for the brain. One of my favorite
Wow.
psychiatrists named Lori Calabrese coined that term, and she said that it's a fertilizer in a sense. And once you have ketamine on board, it's like doing 6 months of psychotherapy, and you can actually change the brain patterns in that person's brain, and the therapy can has a better chance of taking. Now that's, but let's back. So ketamine is not the end all. It's not the panacea. It's not the answer for everybody. First line therapy and family support, and if you're suicidal, letting somebody who you trust and love know that you're suicidal, and then going to a hospital if you have to. Those are the first steps of suicide. Ketamine's not the first step for suicide. But I always end with this. It's like, if you or your loved one were determined to kill themselves and you knew ketamine was an option, would you use it?
Of course, you try
You
it.
you think the answer would be yes, but you'd be one, you're just shocked at like how many people don't even know it's an option.
Well, that's a problem for sure.
And so that was the purpose of the book. It was the
Yep.
revolutionary ketamine, which is this little book right here. Um,
Yep. Great.
that was the purpose of it. That was the initial. It doesn't help me quit my day job, but it saved lives. And actually, the owner of Skyhorse Publishing, when he first considered the book, he just asked this question: is it going to save lives? And our answer to Mr. Lyons was, yes, it will save some lives. And he said, okay.
Let's go.
That's how it started, man.
Outstanding. So, Jonathan, let me ask this question. Someone's administered a microdose, and the plasticity of one's neurons change. Is that a microdose that needs to be repeated regular on an interval?
For some people, yes. For some people, no. Sometimes one treatment's good.
Yeah.
For others, I have a client who was a first responder at the Mandalay Bay shooting. So, over 68 or 70 people were, viciously killed, from a gunman, at one of the hotels. And he has PTSD, and to this day, he gets monthly or every other month ketamine treatments. He says that's what does it for him. Yep.
Mm. Side effects, ill reaction to the psychedelic?
Um, there's, one thing we can get out of the way. Pharmaceutical grade ketamine has nothing to do with street ketamine. Street ketamine is just that. It's impure. It's got additives, usually laced with fentanyl. And to get the high from street ketamine, you need to take it in grams. In a proper clinic where ketamine is administered, it's pharmaceutical grade. It's clean. It's given in an IV. It's a controlled dose. And it's, say, you start off with what we call like a 0.5 milligram per kilogram, which is, anywhere from maybe 60 to 100 milligrams total. So if you think about it, it's a tenth of the dose of a street ketamine. Dr. Dave Feifel at the Kadima Clinic in I'm in San Diego, excuse me, did a study of 6,000 patients who received ketamine treatments. And he could count, basically, I think he counted 6 or 7 that became addicted to it.
Very, very small.
So addiction is a risk of any drug, right? But when done in a proper place with proper therapy, the benefits highly outweigh the risks. And anyway, used properly, its risk profile is very small. If you have coronary artery disease or things like that, it's been safely used in people with coronary artery disease and elderly patients, even in their late 80s. Even I've seen cases. So it's safe from that standpoint. Now, the danger is if people come in on other drugs and don't tell you.
Yes.
Like, let's
Right.
just say they're on chronic painkillers and and like, yeah, they're on like 3 to 5 Percocet a day, or, oxycodone or Oxycontin, God forbid, and they don't tell you. You
Right.
mix
Yeah, you
ketamine
got
with
an issue.
that,
Well, it's any drug, right? If
any
they're going
drug,
to
right?
not
Game over.
disclose. Yes.
It will, and that can kill you. And that's the point of like having a board certified anesthesiologist watch over your session with proper monitoring, who's experienced at sedation, and that's how you do it the safest. Nowadays you got nurses, nurse practitioners, psychiatrists who have little training. I mean,
Yes.
relatively in giving drugs like ketamine. And there's some who do it well, don't get it wrong, but there's been deaths. And it's just, it was from preventable things like knowing their medical history,
Well,
you
yeah,
know, because and then that gets to, like, it matters who gives you the ketamine,
of course.
and not just from a safety aspect, or somebody who's trained in like ACLS and things like that. It's a very safe drug. Like I said, it doesn't stop breathing if given properly and things like that. But it goes into something you said at the get go. It's a spiritual journey. You can't just go into a box with four walls, get hooked up to ketamine, and not have, you need to have the proper music. You need to have confidence in that person giving it to you, knowing that they're doing the best thing for you that's possible.
Oh, I'm so glad you brought that up.
I think that's an important part of it. I really do. And I think there's a lot of ketamine clinics that don't achieve that. And not to say they're doing a disservice, that they're getting proper therapy, but it's not the best it can be done.
Right.
And, it comes into that spiritual part of being a doctor, that people can feel, they know.
I want to ask a question on that specifically and then dive a little bit deeper if we could.
Sure.
And this seems obvious, but I'm sure it isn't, or it's more complex than just a simple question. But how do you navigate the ethics of consciousness exploration in a clinical setting? And I guess what I'm asking is, where does the medicine end and the philosophy begin?
Yeah. There's probably no perfect answer for that. I think it's
Hmm.
different for every person. Their journey is going to be their journey,
Right.
right? And it depends what dragons they're trying to fight.
Well said.
You know, for some, those dragons started when they were just 4 years old. For others, it was when they were in
7.
Afghanistan.
Yep. Yep.
I mean, take soldiers for example. The before soldiers go to war, they don't really know themselves. And then they go on the battlefield, and then they see everybody and they do what everybody else is doing, and then they find themselves doing horrible things they never thought that they were even capable of. And they're protected in the tribe while they're there, but then they come back and the tribe's gone. That's when it bites their leg and doesn't let go.
Yep.
And
Understood.
and so for some people, that's too hard of a pill to swallow.
So let's lean in on that for a second, if I may. I'm interested in your thoughts about altered states of consciousness and how that may have changed your worldview. And to that point, any profound shifts you've witnessed in a patient that have on ketamine that have affected your worldview or your philosophy toward pain and healing.
Sure. I don't think you never can come out of any psychedelic experience the same. Never. It doesn't happen. I don't care if it's, for some people, I think it depends on your ethos, like, do you believe in the logos or not? And, natural laws. And do you think you're on earth just to be on earth, or is there some place past this? What I can tell you is that what I've seen time and time again, like, at an extreme, if you truly think we're just on this earth like a computer, and then when we die, we're unplugged and that's it, and we just go into the vapor, any psychedelic experience, including ketamine, will rid you of that.
Boom.
Boom. Exactly. That's, yeah, I mean,
Right?
have fun with that. And
Yeah.
and
No.
I'm not talking you into anything. It's just something that's
No.
there. If you go through that experience, I don't care, ayahuasca, psilocybin, a high enough dose of psilocybin, whatever. You're lying if you think that you can come out of it believing the same. It's not going to make you like religious all of a sudden, but it has, the out of body experience. And some people tell me, yeah, I saw my mom, I saw my dad, I saw my grandparents, I felt them, I was floating through space, everything, and everything was okay. And that's what they come out of. They just, A lot of people just come out of it going, I have a feeling that everything's going to be okay.
Nice.
That's what I see most often with it, and that's neat to see.
Does that give you optimism in moving forward, and or has that shifted you
Oh yeah, it
in any
gives me
direction?
optimism for treating some of these people. Yeah, I grew up in the Catholic Church, and I still pray the Rosary, and I pray for the optimism of humanity every day.
I'm there
Um,
with you.
and this gives
We
me,
need that.
these kinds of things do give me hope. After seeing what recently happened, with Charlie Kirk, that just emptied me. It took a part of my soul, took a part of America's soul.
Yes, it
Um,
did.
and if there's a time that we need optimism, it's now. You know,
Yeah,
um,
urgently.
it's urgent. It's urgent, and I don't. It's a yeah. I mean, we kind of got into that
No, we're
before we started here, but
it's an
it does
awakening.
give me hope, and that's something I work towards.
No, I appreciate that. If I could pivot for a moment, still common theme, pain. Is pain more discomforting psychologically or physically? And I want to follow that up with questions about peak performance, but your thoughts?
Yes. Um, I'd say it this way. Pain physically is temporary. Pain psychologically is not. One goes away with physiology. The pain you feel like PTSD, that's a rut that doesn't stop. It may be less, it may be more, and that being said, there are some manifestations of physiologic pain like chronic pain regional syndrome, all that kind of stuff, but that goes into the head as well. Pain at its core is still from the brain. And that's something, the we'll get into in a bit, but with the percutaneous hydrotomy, I actually stopped that cycle of pain when, say dealing with chronic osteoarthritis or chronic neck pain or back pain, shoulder pain, migraines, that kind of thing. One aspect of that is actually I use the local anesthetics in the infusion or in the injection. And what does that do? It breaks the pain cycle for that time. And just the act of breaking the cycle, even for a short period of time, can have long lasting effects. So it's the idea of breaking the pain cycle. And it's the same, and it goes back to treating physiologic or cerebral pain, if you will, whatever, psychological pain. We gotta break the pain cycle. You gotta give patients the experience of not having the pain constantly. And just to have that breath of fresh air is what helps lead to healing.
Okay, so let's sit on that for a second. You're a trained anesthesiologist. You've had your residency in France. You've studied VO2 max, EEG biomarkers to quantify human performance, and now you're dealing with the pain management. Um, I'm curious about that. Can you apply the percutaneous hydrotomy as a precautionary treatment for an athlete? Can it be preventative? Like for a fighter, can you use it to dole lactate threshold and improve
No,
endurance athletics?
no, I don't use it that way. I use it
Okay.
strictly if you have an injury, or a problem. It's a good question, actually. I've just never used it in that manner, and never, in a sense, it's to treat pain and acute injuries. That's what it's designed for. But you bring up a good point. I mean, part of a good constitution or a good physiology is having good cells, right?
Yes.
So if you're, in today's environment where we're eating, toxins in our food, dyes, GMO stuff. We're eating, tons of sugars. Now the whole theme is shoving, 200 grams an hour of sugar down your throat while you're cycling, to try to ink out some level of performance. There's going to be long-term issues with that. You're going to affect your cells in some way. And why do I bring up the cells? Well, your cells are like your soil. It's like that French word terrain.
Mm.
And that's the idea of the health of your soil, the health of your cells, and your ability. Are your cells on the verge of being healthy, staying healthy or not? And that's what you see with, when riders crack and they get sick all the time. Well, some aspects of their cells aren't handling the volume of training they're delivering or the dose they're giving themselves.
So, a question off topic, but on topic: high volume training
Mm-hmm.
for an elite athlete, whether it's cycling or running,
Yep.
pain, recovery, can one's mental makeup exceed their physical capabilities? Or said differently, can someone will their way to a better performance?
I think so. I think some people
Yes.
have that gift. Yeah.
Interesting.
I mean, I did to a point, I can say, but man, I mean, working with guys like Bardet, Roman Bardet, Ricky Brabeck's another good example. I mean, he freaking went into the last Dakar 2 months off of a fresh knee, basically reconstruction.
He did.
Yeah. And I
Yeah,
mean, he
that's
barely
remarkable.
made it. I mean, his orthopedic surgeon barely released him. And I mean, he was just overcoming an immense amount of pain. And man, he finished the thing. He didn't win it this time, but he was in there. He was in the hunt. And so I've seen it, in motocross, enduro, and motorcycle enduro racing, those kinds of things. Those guys can place mind over matter in ways that'll most of the population cannot.
Remarkable. I appreciate that point of view. I had the great fortune of working with a couple of the U.S. national team cyclists for several years and got to know the coaching and medical staff. And so
Yeah.
I was always intrigued by how much of this is nature versus nurture,
Mm.
and that sort of broadens the conversation to some extent. So peak performance isn't just physical; it's emotional, it's cognitive, but it's also spiritual.
Oh yeah.
And yeah, and I appreciate our earlier conversations to that point as well. In your practice with percutaneous hydrotomy, can you explain to us how the chronic pain treatment is applied, how the cycle's broken, and what the effects are?
Sure. So yeah, in my new book that I wrote, Percutaneous Hydrotomy, it's a technique from France I learned. It's a fun story. Sam Calavita of the training lab, most call him Coach Cal, and he trains guys like Bo Nickel, David Taylor, recently Chimaev. He
Hmm.
trained. I mean, yeah, he just recently won that fight with Duplusis. He had Bo Nickel, and he'd already gotten epidurals for his back pain, and he was on the verge of having surgery. And he's like, "Doc, I got this. I heard about this new treatment, and it's in France, and you speak French." He goes, "Do you think you could learn it, and maybe we can try it on Bo's back and see if it's going to help him?" At first I was like, I'll look into this. So I looked into it, and then I had elbow pain at that time, and so as an anesthesiologist, needles are my wheelhouse. So
Right.
I got everything out in my lab and did it clean and all that kind of stuff, and kind of injected my elbow, and I couldn't believe it. The next day it was 80% better. Like, oh, there's something to this. So,
Wow.
I wanted to see. So I went to France. I learned it, saw everything that was done with it. And Dr. Gez has done over 500,000 patients. And so, it was good training. And basically I learned and I brought it back and we did it on Bo's back. And lo and behold, I mean, 2 weeks later, he was able to like return to complete, full training, and his back
Remarkable.
got better and he didn't need surgery. Now, that being said, it was the percutaneous, the sole thing that helped him get back to training normal. No, it was obviously the plethora of things that he was doing. The rehabilitation, probably the previous epidurals helped to some extent, but the percutaneous hydrotomy helped break the pain cycle. So in the hydrotomy, imagine that as a long acting diffusion system. So hydrotomy just means water. So by
Hmm.
using physiologic saline with a mixture of local anesthetics, anti-inflammatories like ketoprofen or toradol, trace minerals, many minerals help osteoarthritis and other things. And again, it's part of treating the cells. Other medications like pentoxifylline helps get it deeper and it has some other properties. procaine, that's another anesthetic. You might use amino acids. Cells obviously use amino acids. And then sometimes if you have like slip discs or things like that, we'll add in a steroid called Decadron in a very
Yes.
dilute dose if you need it, not always. But in that case, for Bo Nickel's situation, it helped make the difference. So he was kind of the first athlete I did, and then from there, I mean, I've treated numerous UFC fighters, some pro tennis players, a lot of amateurs. I've treated numerous motocross athletes with it, as well as people with frozen shoulder. And a lot of people say, "Oh, how can the saline just heal things or help?" Well, it's not just the saline, right? It's the other things that go along with it. But the thing I point out in the book, saline is not just a placebo. Saline also has a therapeutic mechanism to it. And a guy named Roy Altman, Dr. Altman out of UCLA, I believe he's passed now, but he did a big meta-analysis on this. And he showed that saline is not just a placebo, pure and simple. And you can look in
Wow.
any study and you can prove it to yourself where they use quote unquote saline as a placebo and say PRP in the other arm. And what do you see? You see an improvement with both arms. Not one study can you find with that where they do that saline had a zero response ever.
Ever.
So
Wow.
there's anyway, it's something I tried to point
This is
out.
really
Yeah,
cool. So yeah,
yeah,
so you're using evidence-based approach, which I
yes,
really appreciate, and you're making treatments that some may think are controversial more normal, not as controversial, but you're challenging the conventional thought process or the medical establishment and how they normally
absolutely,
just
yeah,
rigor and they're static. You used the word neuroplasticity earlier, and I really appreciate that because I can see the plasticity in this medical philosophy as well,
yep,
and that
yeah,
approach.
yeah, yeah. And I actually
So,
presented it at the 50th Regional Anesthesia Pain Conference in Orlando, and in front of a room full of doctors, and I just presented the back pain study we did, where we had 20 something patients and they did 6 months of this therapy or at least six treatments. And in 80+% of them, it helped them get off of their pain meds and have more function, help them return to rehab earlier, and almost no side effects. And that's the point. It's not the panacea. It's not the end all, but it was well received. And of course the questions were asked like, well, is this going to be covered under insurance? I doubt it. There's not a lot. There's nothing a pharmaceutical company can take advantage
right,
in the procedure and make a ton off of.
profit or
Will it get a
purpose.
CPT code one day? Gosh, I hope so. But for right now, it's you pay cash for it, just like PRP or something like that. It's not as expensive. There's a lot of doctors who do it in Europe, and I'm starting to train physicians and nurse practitioners and PAs, how to do this. And it's relatively simple once you learn, you know.
No, I appreciate that.
But again, it goes back to taking care of the cells.
So, to that general thought, taking care of the cells, to someone in the audience, someone listening, we've talked about emotional pain, we talked about physical pain, we talked about altered states, we've talked about a variety of different things relative to understanding one's condition. What advice or guidance would you have someone that's confronting a personal issue that's causing pain, whether that be financial, career change, family disruption? From your experience as a trained physician, what lessons, what antidotes can you provide on how to process and break that down and emerge stronger?
Yeah, that's good. That's a question of the century right there.
Right. Yeah.
Uh, not you got to find
Well, your
somebody you connect with.
your perspective is uniquely different than many that I speak to. So I appreciate the way you're
Yeah,
delving into
yeah.
this.
I think, well, for sure, it's connecting, you know, several facets to that question. Unfortunately, in today's medical environment, so many doctors are pushed to see 20, 30, 40, 50, even 60 patients a day. I mean, you can't give any quality of care doing that. You can just basically say hi, bye, and they leave with the prescription. You know, there's no spiritual interaction with that. And then the other thing is, like, it's really hard to see the doctor nowadays. You're usually put with a, nurse practitioner or a PA, and that's, it's appropriate for those, to be seen by, what we call mid-level in many cases, but people want to see the doctor and they're not, it's so, I get that all the time. It's almost impossible to see the doctor nowadays. But then you also have to go back to the training. Basically, between, medical school and residency, you're doing, over 16,000 hours plus of training. But in very little of that do we get the idea that, it's a spiritual practice as well. People's hopes and future and their aspirations kind of hang on your diagnosis.
Mm-hmm.
And I don't think enough physicians appreciate that in some. I think they know it, but the system doesn't let them express it.
Understood.
So I think there's that. If you just sit down with the patient and let them speak and you listen, they will tell you everything.
Everything. If you could distill all your lessons on pain, performance, consciousness, and also self governance into one guiding principle for living, what would that be?
Learning how to listen.
To listen. That's where I thought you were going to be.
You got to,
Listens to one's biorhythms, one's situation.
yeah, and it's not just listening to the person, it's listening to their body. It's, feeling their pulse. How do they shake your hand weakly, or, with some strength, which can be predictive? Do they look you in the eye? Are they looking down all the time? Are they, there's, it just goes way beyond, and it's listening. It's listening to that person in front of you.
So, for someone that's in pain, is the lesson to find someone that will listen to them,
Yeah.
or
Yeah, to listen to them. And that's a hard
right?
thing,
So it's two
you
way.
know.
There's a
Yeah,
dichotomy. Yeah,
it's
duality
hard,
to this.
man.
I appreciate that.
I I'll be the first to tell you, man. It's those running busy pain practices. I mean,
Yes.
it's a hard one. And there's some docs who do it well, but I would say it's most who just kind of turn and burn and see as many patients as they can, and that's it.
Jonathan, a question. Let me preface it. You've had your medical testimony and briefs read before the Supreme Court. Well, without going into that topic per se, a remarkable honor to have a document read to the Supreme Court. So kudos to you. This question may feel like it's coming from left field, but I think it's all related. What happens when we die?
I think I think you have a lens that you look through, and that lens is clear when you're not dead, or, not going beyond your body. And that's part of our human vessel, if you will. That lens is cracked. And if that lens cracks all the way, you're leaving the body. From the near death experiences that I've read several, from Catholic priests, to there's a great TED talk on a person who had a near death experience and came back. They all left with their consciousness. They all knew person, place, time, situation, but they weren't with their bodies. And there's people who can tell you exactly what, when they leave their body in the operating room, the details, to the point that it's undeniable that they saw everything that we do from a different perspective, and then from the other things I've read on, like, the soldiers doing ketamine and having out of body experiences, and they're, they have these visions of their guns melting as they're trying to fight the enemy, and, the regret of losing their fellow soldiers, and then only to have those fellow soldiers while they're in the experience and come up to them in white robes and just put their hand on their shoulders and go, "Hey man, it's okay. I'm good."
Mm. Wow.
I believe that, when you go into the afterlife, that consciousness is taken with you. And I've witnessed many, many, many deaths in my career. From trauma, from I did trauma anesthesia for a long time. I did, I've done cancer. I've done, I've seen patients. One of the most profound experiences I got to be a part of was the death of a priest. He was a friend, actually. And long story short, he had this, neck ankylosis, and he decided to have it operated on, even though it was very risky. And he wound up getting an infection that he couldn't recover from, and then went into a coma, and we had to take him off life support. I watched him being taken off life support, but I'll never, ever, ever forget seeing the movement of energy leave his body. It was unmistakable. It was like that energy like just was whisked away from the human vessel. And so when you ask like what happens when we die, that's what I witnessed anyway, and I've seen it in more than one person. That energy, that movement of energy, like I don't know, going from the feet or wherever you can. It's Yeah, it's hard to describe, but it's
Yeah,
something you know it when you see it. You
for sure.
and and so I don't know. I hope that's my answer to, if you ask me what happens, when we pass. Those are the things I would say.
Thank you, Jonathan. Your courage, your curiosity, your commitment to excellence, in my opinion, are a masterclass in living intentionally.
Thank you.
I have a final question for you as we
Okay.
come up to the hour now. What would you want to teach your younger self, the person who is just beginning to understand loss, pain, and possibility?
It's That's a hard one. I think you gotta. I would have taught myself to go easier on my younger self when it didn't work out. Since 7 years old, all I wanted to do was be a professional motocross racer. I was just one of those kids who was determined. At the second I realized it and I knew the sport, and I know that's what I'm going to do. And I worked my whole life until I was basically 19 to be that person, to be in that sport. And I made it pretty well. I made it to like good amateur pro, and then actually I won my first professional motocross race when I was in medical school. After, I didn't keep race, but I kind of picked it up again in
Right.
my fourth year when I had more time. No way you could do it your first 2 years, zero chance. And then, anyway, I picked it back up and I won that race. But then I think back, and I look at where God's put me, and I wasn't supposed to do that.
Okay.
It took a lot for me to say, okay, I'm going to give up my dream of being a motocross and I'm going to go be a doctor now. And I was very hard on myself, and I trusted a lot of things without knowing what I was getting into. And that, of course, trusting is your truth, right? And truth is the adventure of your life. I didn't know that at that time. And I was super duper hard on myself. I worked so hard to make it and I didn't. But now I look back and I think I'm where I'm supposed to be. And I'm
That's
and
outstanding.
I'm thankful
No,
for
thank
that.
you. You
Yeah.
dropped some real knowledge. Trusting is truth. Truth is the adventure of life. That's another book for you to write for us.
Yeah.
That was pretty fantastic.
Thanks.
And then clearly we're going to do some merch for you that says "Needles are my wheelhouse," because that by itself is a cool hoodie that we've got to make for you. So I'll be in the print shop this weekend knocking a few things out.
Cool, man. Yeah,
Um,
it's just there's
yeah.
that's the book we were talking about,
Well, that's what
Stopping
I was going to
Pain
ask
and all
about.
that. So you can find that anywhere
So,
books are sold. Skyhorse Publishing, on my website, Amazon. Remember,
and again, that's Stopping Pain, a simple revolutionary way to beat chronic pain.
that's
And
it.
that's about regaining your vitality
Just
with
came out.
percutaneous hydrotomy.
It
Just
just
came
came
out.
out. Yep. And so
And
hopefully that makes a difference in people. And I'm reachable. Just look on my website.
someone wants to reach you for a speaking engagement or for a consult,
Sure.
what is the URL for your website?
JonathanEdwardsMD.com.
And that's spelled
JOHN.
JOHN.
Mm-hmm.
Yeah, fantastic. My new friend. Beyond
Yeah, no,
grateful
same
for
here.
this. I can't wait to have you at my studio here in Maryland, and we get out on the bikes or go for a run, and
Yeah, man,
just
we're gonna go for a ride soon. I can't wait.
I'm looking forward to it. To our listeners, stay sharp, stay curious, keep fighting the good fight. To anyone suffering, listen, ask for help. You're not in it alone. Dr. Edwards, I'm extremely grateful for all that you've broken down and distilled, and for the care and selflessness that you continue to put forward every day.